There are some physical therapy modalities. Now, I sometimes, a great physical therapist is worth their weight in gold, and we have some great ones that we refer to, but not all physical therapists are able to resolve big toe arthritis, right? They can help a little bit with the arthritis. They can help strengthen some of the muscles around it. They can help your toe to purchase a little bit more by pulling it down. There's a technique where you can just almost like cracking your joint, you pull it out and you relieve some of the tension that's in there. So it almost gives the joint a little bit more space. There's actually a surgical technique that's similar that decompresses, we call it, the joint and gives it a little bit more space. Those are helpful, albeit probably temporary, and it really depends on the amount of arthritis. So as Dr. Carolyn showed, it may be like mild to moderate, but you know, the severe and the one that's almost fused, not going to work so well. So some of these can work at different phases when you're dealing with your hallux limitus or your arthritis in your big toe joint. Cortisone. I use it more as a diagnostic and a therapeutic tool in the office. That just means it's going to help me to diagnose. So if you do an injection to that joint that's bothering you, and all the pain goes away, you can realistically say that that joint is the problem. And if you fuse that joint, which Dr. Savvy is going to talk about, and there's no more joint there, that's what it's going to feel like. There's not going to be any pain. I tend to use a limited number of cortisones. I know there are certain specialties, for example, maybe in the hip and the knee, they'll do it every 3 months. They'll do 3 a year, pretty much forever. Or they'll do a type of a Synvisc, which is a lubricant. In our practice, we don't use those. I think some people might use something like that, a lubricant. We're not doing that. We have some kind of regenerative, some advanced things that we kind of play around with that might or might not work. But a limited amount of cortisone, I think. The reason I use cortisone, for example, if someone's going to go on a hiking trip and they know that they're going to do a lot of activity and they have arthritis in the big toe, I'll say, why don't you come a week or so before? I'll give you the cortisone. That'll last you through your hiking trip and you'll be able to feel better. Okay, that's how I use cortisone. Dr. Feldman alluded to this alternate lacing. I just have an example right here. Basically, you can put the laces here or even skip these. You skip up. And so if you have a bump on top, a big arthritis up there, it can be helpful for that. Here's an example of a shoe that actually has biased lacing. You can see it's not right in the center. I think this one was a gel Cayano type. I know we're not supposed to talk about shoe types, but this is one that there's not many that are like this, but it's on the side and it helps the big toe to bend and move a little bit better. Shoes are really important for this. And then there is a possibility if you have a really inflamed joint and it really hurts a lot, you can do a type of a taping technique. I don't think I've ever done something this extravagant, but I've tried different types of taping. If you want to mobilize it as well, you can put some into a walking boot. These are if it's really, really inflamed, if you really overdo it. So I might do this with a cortisone injection or with a walking boot just to calm things down until you're able to do more definitive treatment afterwards. I just want to explain just kind of my philosophy behind like orthotics. And someone also asked about this wedge that Dr. Savage is going to talk a little bit about. But basically, if you have a bad joint, if you have that really bad one or severe arthritis, you want to reduce the movement. And you can do that with like a carbon plate that goes in your shoe. Or this is a kind of an example of an orthotic that has this extension in the front. So both of these are used to not allow that to bend. Now, if you have a better joint, a good joint that has hallux limitus, or we haven't talked about this, something called functional hallux limitus that I think Dr. Savvy is going to talk a little bit about. And I'm actually going to put this on the link afterwards on our blog. I'll put he has a couple of good blog articles on hallux limitus. I'll include that if you'd like to read those. But I'll talk about if you have a good joint, really not much arthritis, how you can increase the movement with different modifications in an orthotic.